On this episode of the Ask Mike Reinold Show, we talk about eccentrics and whether or not they are the cat's meow for treating tendinopathies. The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Before we get to the podcast, I wanted to make sure you knew about my free online course on the Introduction to Performance Therapy and Training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We are up here at Champion PT and Performance, answering all your amazing questions on PT, fitness, sports, performance, whatever it may be. Mike Scudetto, Dave Tilley, Lenny Macrina, Dan Pope here answering all those. We already talked about that.
Lots of questions, lots of answers.
So we're getting tired here. We'll see. But anyway, we are back with another episode, and I think we got a student with us.
We have a student.
We have a student with us.
He has been with us for months upon months, all by himself. So we welcome Dr. Trey Martin from East Tennessee State University.
Laid back.
He is our first student from East Tennessee State University. It's been amazing. We are very happy to have you. Can you give us a fun fact about you, Dr. Trey? A fun fact about you, your childhood, something that the listeners would really appreciate.
Okay. Once when I was 8, I was at a basketball game playing tag with my brother. He tripped me. I went headfirst into a wall, had slight concussion. I almost fractured my orbital bone. Didn't. I was good to go. And I haven't talked to my brother since then. It's been a really bitter time in my household.
Almost fractured. Is that like almost pregnant? Like, how do you almost fracture? Like,
it was risky, you know. It was a big blow,
gotcha.
you know.
Not quite the same thing.
Gotcha.
All right.
Family issues.
Let's get to the question.
It was weird and it got weirder.
Yeah, weird.
I think that's possible, but
Dr. Trey. Dr. Trey.
We've got Christy B from Uptown.
Cardi B.
Are eccentrics for tendinopathies really the cat's meow? Or is it really just time under tension that makes the difference?
I thought
That was the best question ever asked.
That was pretty good. And she's not really from Uptown, right?
What's Uptown?
What's Uptown?
Is that
Uptown
Christy,
fun?
New York?
Yeah.
Christy
Uptown.
Brinkley from Uptown? Is that Billy
She's an
Joel?
Uptown girl.
Does this have
Real
something-
Mars?
Yeah, right? This is definitely.
Can we shout out Waddles? He's from downtown.
Well, downtown Waddles. He's not. He's in acute care somewhere. So anyway, what was the question again? All right. So eccentrics for tendinopathy. Is it really the cat's meow? Great question, Christy Brinkley. Who wants to start this one?
I defer to Dan Pope in the
Poster.
tendinopathy
All right,
world.
why don't we start with are eccentrics effective at tendinopathy?
Yes, it seems so.
All right, good episode.
All right, guys, we'll see you next time.
Wrap it up.
What does the cat's meow mean? Like it's like.
Is there another like a dog's bark? Is that a...
All right, so Dan, what's your take on eccentrics for tendinopathy?
So I guess, in terms of literature, a few papers come out saying that eccentrics are very helpful for tendinopathies, right? So we kind of thought that this was maybe the main thing that's going to help with people's tendon problems. Let's really hit them hard with eccentrics. And then more papers started coming out where they're looking at eccentrics versus concentrics, starting looking at isometrics, and they're all gaining kind of similar results,
Right.
So it became one of these things like, do we really need to be focused on the eccentric? And I would argue probably not.
Right.
And it seems like one of the most important things with tendons is that, they probably need to be loaded. We don't know how much. I mean, we don't necessarily have the research to say that it needs to be heavy, right, versus basically just loading over the course of time. We're not really sure if strength is the big thing that makes tendons get better. They've done some research where they look at the tendon, they biopsy it, and they strengthen it, and then it gets better, but it doesn't really change what the tendon looks like, right? So I don't know that we know exactly what we're doing when we load the tendon. I don't know that we know that there's one intervention that's going to be better than the others,
Yeah.
My big thing is if you have an athlete or an individual in front of you, you have to think about their goals and what they were trying to get back to, and think about some sort of exercise that's going to work for them and fit into their schedule and get them back to the activities they need to get back to. And if we're trying to help those folks, we also need to figure out why this tendon got painful in the first place and try to fix whatever caused that,
Yeah. I mean, well said. That was good. Mike, what do you got?
Follow-up question for Dan. What kind of guidelines do you use for your patients in terms of
pain while exercising versus pain after exercising, trying to manage a tendinopathy, say lower extremity tendinopathy?
Pete Malieres, was he the patellar tendon guy who did the? So I think his guideline was that if you have some pain during, that's fine. You want to make sure the next day your pain levels are back to their baseline. I think they used like a single-legged squat, and basically what was your pain with that single-legged squat, and if it was like, let's say a 3 out of 10, and then you exercise that day, gets a little sore the next day, you're back to a 3 out of 10 or single-leg squat, they're okay with that. Generally what I tell my athletes is that I want to see them around a 3 to a 5 out of 10 or less, right? That's fine. I want to make sure that at that night it doesn't flare up a ton, the next day they're kind of back to their baseline. So those are my general guidelines with most tendon problems, and to be honest, it's my guideline for pretty much every pain problem that I see. You know, it's not just reserved for tendon issues. And I think the big thing is that you need to dose your exercise appropriately, and you use pain as a guideline to do that. But at the end of the day, I just tell my athletes, like, look, if you hurt while you're doing these exercises, but over the course of time, from week to week, month to month, you're improving, the pain is not that important to me. The big thing is, are you making progress? So
I like that. There's a lot that goes into that with the pain thing too. Is, you know, everybody's number, that's just a subjective number, that it varies. So I think you have to tell them that range, like a 3, 4, whatever you want that range to be, but you also then have to play, does it go away tomorrow? And I think you said that really well. I think you have to put those two together. Yeah, sorry.
No, I was just gonna say, I think I've learned a lot from Dan, especially with like his concept of like fighting fire with fire. And I think that the precaution I would give to people is sometimes, especially in the younger population, it's really hard to differentiate sometimes between a growth plate irritation and like a patellar tendinopathy. And you got to realize that that's eccentric contractions is probably the way they flared up the growth plate and stuff. So I've made the mistake of maybe not being specific enough in my diagnosis and throwing a little bit too much at them too soon, and they get much worse because it's bony edema. It's not the tendinopathy that's really the symptom generator. So just be careful there on, like, you know, the 24-hour response is really important, because 24 hours is not enough to make a bone, you know, calm down.
I like that too, and I think that's a good reason to say that Eccentrics isn't necessarily the cat's meow for tendinopathy, because, you know, sometimes it is, sometimes it isn't. But I think what happened, here's my take on what happened with Eccentrics with tendinopathy, because I was looking at this recently for some talk that I did, and I think essentially what happened is we went from like doing like straight leg raises and like knee extensions with an ankle weight for somebody with patellar tendonitis, and then we compared it to eccentric training, which is way more tissue tension, way more time under load, like you kind of like said in your question in there, right? It's a big difference. I don't think that's apples to apples. I think that's like apples to oranges, that, you know, you have somebody doing really a basic like 5-pound knee extension, and then all of a sudden they're doing a body weight step down eccentrically. That's way more load. So initially everyone says like, oh, it's eccentrics, right? They assumed it was the eccentric component and not maybe the time under tension or the increase in load. And everyone's like, well, eccentrics work. And then what we started to do is we started to see like different studies come out, and isometrics have been shown to be effective with tendinopathy. So, you know, you have a really aggressive isometric contraction, so now you're not getting that eccentric load, but you're still getting some tension and stress on the tendon. That's been shown to be effective. And then now the next thing we're kind of talking about now is essentially combining concentric and eccentric. So a heavy concentric with a slow return to the start position, which is like getting back to the fundamentals of just like strength training, right? And they're starting to show that may be even better than just eccentrics in and of itself. So I wanted to historically kind of cover that in our answer, because I think that's why we got to this where everybody's like eccentrics, right? Because we're always like 5 years behind, right? Like 5 years ago it was eccentrics, 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 and it takes a while for the new research to get into like the public like kind of head, right? So if you haven't been up on the data, you haven't been up on paying attention to this, you probably think, you know, eccentrics are still the way to go. But I think you're right. I think it's about load and time under tension, and it's about doing that, and it's probably about having multiple ways to stress the tissue, both isometrically, concentrically, eccentrically, and then maybe during different phases you kind of you know, put those all in.
I feel like I'm moderating this episode, but
I like this.
Another question for the group: like, where do we think like blood flow restriction fits in with tendinopathy treatment?
I like
That's a good question.
I like that.
This is
a big episode. This is a big episode.
I guess we don't need to throw down that.
From what I've read, and maybe Dan or Dave or even Mike, the mics would know, doesn't seem like blood flow restriction. We're still scooting. It doesn't seem like blood flow restriction affects the tendon at all. It will affect hypertrophy of the muscle. but there's nothing in the literature that I've seen. I feel like I've seen it in numerous spots that it affects the tendon itself. So maybe you get more hypertrophy of the muscle. What that means for the tendon, I don't know. It's going to look better when you're wearing your jeans, but I don't know if it's necessarily going to affect the tendon. So the historical aspect's important to understand. I think Jill Cook has a lot of good stuff on there and on Twitter and all of her research. And I think another concept to understand is when you look at tendons, MRI or anything else, the amount of pain does not correlate to the amount of pathology, tendinopathy, structural issues, versus people have pain and you do an MRI and there's nothing structurally going on. So I think, again, this pain concept is all over the place. I think just getting them to feel better and move better and load them a little as much as you can and make them feel better about loading the joint is my approach. That's how I treat people with tendinopathy, you know?
I could be wrong, but the last that I read on the pathophysiology, maybe you're more up to date than I am, but like a lot of the tendon issues, especially the like chronically irritated ones, are like a very big ingrowth of like not so great pain fibers and nociceptors that are like kind of not supposed to be there, and the collagen fibers are real kind of mixed and mangled. So I think the blood flow is more of a metabolic effect, where the loading is what actually makes the tendon get stressed, and I think induces some of that remodeling. That's the last I read, but I could be very wrong.
And all of this may just hopefully get some remodeling. Maybe that's the point of all of these types of contractions.
The blood flow or the tension
is that we get that, and if blood flow restriction helps to allow you to do some higher threshold activities, you know, then great. I think that's, you know, potentially helpful.
And I think the blood flow restriction does, from what I've seen, have some analgesic effect as well. So if you have some anterior knee pain, or maybe it changes the nociception, being able to do that, then you can load them in an eccentric fashion or something like that. To me, that's beneficial too, and I would use it that way, and I use it that way. So that's my thought on blood flow. I would try it, but not necessarily for the reason of thinking you're getting hypertrophy of the tendon or changes in the tendon, because I don't think that's happening.
All right, so bringing it back, Eccentrics, probably not the cat's meow. They're great, they're good, right? But they're probably not like, wow, you have to do like just Eccentrics. I think you nailed it. It's loading the tissues there, and I think the science is starting to show that. So by all means, combine all of that and use it at the appropriate time with the right person, I guess, right? So great question. Thanks so much. Head to MikeReinold.com, click on that podcast link, and you can ask us great questions like that. Anything you want to talk about, we're happy to answer, and we'll see you on the next episode.